take one, and it's gonna be the only one, right? Jay Smolinski, take one. Caffeine, Starbucks. They know my order. So I went to go deliver a patient, and I'm in the room, and it's this woman's first baby, and I see the husband, and I'm like, I've seen him before. And he goes, do you order a white chocolate mocha in the Eden Prairie Starbucks every morning? But yeah, he's my Starbucks man, and I delivered his baby.
Dr. Smolinski, she's my wife. Jen is great. I just love her. She's one of those type of people you just want to pick her up, put her in your pocket, and carry her around all day.
My kids know that we deliver babies. My son, who's 5, is very interested to know if they're coming out the way they're supposed to or from the belly. So he's always asking about that, and if he sees that I'm throwing on my scrubs, he's like, are you going to the hospital to have a baby? And I said, yes, honey, I am. I actually always thought I wanted to be a pediatrician, actually. I did every elective pediatrics until I did my OBGYN rotation and went, wow, this is where my heart's at. I love women. Women are amazing. They tend to take a back seat and think of everybody else before themselves.
Dr. Smolinski is like a best friend. She always knows what to do and what to say to lift you up when you may not even know you need to be lifted.
I see people during their pregnancy and I say, how are you really doing? You know, how are you really doing emotionally? And sometimes people will just cry. I always have a box of tissues in my room because I tell people I'm sometimes your therapist, sometimes I'm your priest, you know, I just tell me whatever you need to know that's going on with you personally. And I've had many people say, you know, no one's ever asked me this. No one's ever asked how I'm doing. I think being thorough is not just looking at the gynecological things that we need to look at. It's actually looking at the whole person, the whole picture.
Dr. Smolinski loves true crime, and I think that part of that is because she is a true medical detective. She will take the most complicated patients.
I'm totally obsessed with true crime. And I'm also obsessed with Judge Judy, and it kind of all goes together because I like to understand the person that I'm talking to. With
symptoms all over the place that no one really ever thought fit together, and she will boil them down and turn them in her little head, and all of a sudden it's the most easy answer.
I kind of consider all people a puzzle, whether it's, you know, they have something that's not been yet diagnosed that's going on with them, or if there's something from a mental health perspective that we're looking into.
And the patient benefits so much from her thoughtful way of just putting all of the complicated pieces together.
And every person's a little bit mysterious. It's fun to try to figure them out. I realize that, you know, in our profession, when you see patients, they're at their most vulnerable. You know, they're scared to be there, whether it's, you know, you're getting their first pap smear, or they had an episode of bleeding that's not expected, or, you know, they think they found a mass in their breast. You know, they're at their most vulnerable. My job as a provider is to give them the attention that they need to take care of themselves and to empower themselves. And I know I'm doing a good job when I see patients back year after year after year. And then the women start bringing their kids to me. It's when they ask for a hug when they see me, either at the beginning or at the end of the appointment. It's the Christmas cards that I get, you know, of the family that they're expanding. So it's the little things, you know, I don't need a pat on the back, I just need to see their faces again.